A new study out of Harvard University links heavy mouthwash to type 2 diabetes. Here with more, Dr. Richard Chaffoo. Dr. Chaffoo, good morning. Always good
morning,
to see
Shally.
you.
Good to see you.
People are probably brushing their teeth maybe right now.
Exactly.
Getting ready for that mouthwash. What does this new study say?
So it's a fascinating study, Shally. They looked at about 1,000 people, and they took that group, and they were like a 40 to 65 age group, and they looked at people that, used mouthwash once or less a day, and those that used it twice or more a day. And they actually found that in that group that used it 2 or more times a day, there seemed to be a higher incidence in those people of pre-diabetes and type 2 diabetes, which is, can be diet controlled or can be insulin related, occurs in adults. And the theory behind that is, Shally, that the actual mouthwash destroys some of the bacteria, obviously, that cause us to have bad breath and cavities, but too much use of something like this kind of a mouthwash destroys the normal bacteria, and it's those normal bacteria in our mouth that are responsible for producing a chemical called nitric oxide. Nitric oxide has been linked and associated with the metabolism and regulation of insulin. So the theory is that there may be some association between the lower level of nitric acid in those people that are overusing mouthwash and the tendency to perhaps either be in a pre-diabetic or diabetic state.
I see. So if you want to use mouthwash, then what are you supposed to do?
So probably once a day or less. Now it is important, I think, for everybody to understand that there's not a direct causal relationship, that this is an association, and so there are going to be more studies that are going to be ongoing. And it's important, I think, to remember that the American Dental Association has come down on the side of saying, really for great dental hygiene, you just need to brush and floss. And mouthwashes they're okay, but they're not a necessary part of your daily routine.
Okay, let's talk about something else out in the news. Dr. Chaffoo, I can never keep track because one day they say too much coffee is not good for you, then they say it's good for you. It's like the chocolate and the wine.
Exactly.
But now they're saying coffee is good.
Well, it's interesting, this is another study that was done quite recently, Shally, where the researchers wanted to look at or do a study on the association of coffee and liver disease. And so before doing that, they did a preliminary study and they reviewed all the literature in the world related to coffee consumption. Heavy coffee consumption, 3 to 4 cups a day or more. And they found that when they looked at all these studies, that people that consumed 4 or more cups of coffee a day seemed to have a reduced incidence of diseases and also deaths. So mortality rate seems to be lowered. Now, what's fascinating about this is even in women, of course, they found the reverse. Women that tended to be heavy consumers of coffee had increased risk of fractures, bone fractures, increased risk of cancers like lung cancer. Now, what's fascinating is they looked at the data and how well designed all these studies are out in the literature, and they found that really the studies were of very poor quality, and that's something important to emphasize to our viewers. And what they found in this one subgroup where they looked at women, they looked at the association of coffee and lung cancer, is that the women that were heavy consumers of coffee were also heavy smokers. And so therein lies that link.
So can you drink, though, a few cups of coffee and be okay? Like, what is our takeaway from this study? Drink it or don't drink it?
Well, the takeaway is there's probably no real harmful effects from, moderate consumption, but certainly large consumption, the data is still not quite out there. Now, I will say that most physicians do recommend to be careful about your caffeine consumption. We know it does have an effect on gastroesophageal reflux. If you have hypertension, too much caffeine may not be a great thing. If you suffer from cardiac disease or arrhythmias, obviously if you're taking certain medications like stimulants for ADHD, that can potentiate or make those effects worse. And certainly in pregnant women, we do want to avoid caffeine because of the risk of miscarriages, low birth weight, premature delivery.
All good advice. Dr. Chaffoo, thank you. Always good to see you.
Good to see you, Shally.
7:45. Let's get you outside to Raul.